Happy holidays and Feliz Navidad. This is Frank Aviles from the Frank and Lizzie Show, and today we have the beautiful and smart Lizzie.
I am Liz Faust. Hi, how are you?
Oh, this is great. I love this. We have a great speaker. He's been on the show before, and we're going to highlight some upcoming things at APWCA Wound Week. So let me introduce our speaker. We have with us today Dr. Mark Melin, and we're live, actually. This is the second time that we're face-to-face, and I've known him for over a year, collaborated on a lot of projects, and I tell you what, he's better in person than on picture. But I do want to tell you about Dr. Melin. He's phenomenal. I think he's out of this world. He's breaking some new knowledge that we're going to hear at Wound Week. He's actually a vascular surgeon and wound care physician at the Wound Healing Institute in Fairview. This is part of the University of Minnesota. And I'm going to tell you that at the end of the show, stick around because you're going to hear why Mark and I are here together in sunny Florida.
Yeah, I'm kind of jealous. You guys are both there.
Actually, it was 80 degrees today. We were in shorts, and actually Mark's in shorts.
Oh, my goodness. Well, thank you, Dr. Melin, for joining us. It's so nice to have you on the show again.
You know, it is such a privilege to be sitting here with Frank and Liz. I so appreciate the opportunity to be on the Frank and Lizzie show. I'm going to call it the Lizzie and Frank show tonight, just out of deference to just to how great you guys do together. Great. So, you know, it's a wonderful show. Thank you for all the effort you put together on this.
Yeah, thank you so much. Well, so what we're doing in this episode is talking about Wound Week 2022. It's the APWCA's conference, and it's going to be in Philadelphia at the Lowe's Hotel, February 24th through the 27th. We are lucky enough to have some speakers with us. So Dr. Melin is going to be speaking on 2 sessions. Mark, why don't you tell us a little bit more about what your sessions are titled and what they're about?
Well, we're going to be talking about chronic venous insufficiency, so the history and physical examination, diagnosis, treatment, and then we're going to talk a little bit about, Frank and I are doing together, talking about
the management of edema. But I do want to highlight, because Mark's been doing a lot of work on this area, but, you know, you coined the term love. So can you tell the audience what love is?
Well, and I would, so everything's a teamwork, right? So I look at the nurses and the wound care nurses and the staff I get to work with at M Health Fairview at the Wound Healing Institute. And we had talked about phlebial lymphedema. Now, phlebial lymphedema is that classic historical word that stands for veins resulting in lymphedema. And so typically how people look at is treat the veins first, and does the edema go away? So as we sat here and talked about this in our meetings, we talked about what if we lead with something called love? Let's recognize the lymphedema first, go after the lymphedema as we're working on treating the vein. So that's where love comes from, is lymphedema of venous etiology. And we talk about leading with love. So we're very focused in our wound clinic on treating the lymphedema component of lower extremity ulcerations, including diabetic foots, because we know that diabetics also have significant lymphedema. So we really go after that love portion, the lymphedema, in managing lower extremity edema. And so we get involved our certified lymphedema therapists, manual lymphatic drainage, complete decongestive therapy, which would be the correct answer to the question of what's the standard of care for edema and lymphedema management. It's complete decongestive therapy. So we work very closely with our certified lymphedema therapist in terms of getting this maximally managed, and accelerates wound healing and also decreases recidivism rates.
Yeah, I mean, I think that question was just one of our Trivia Tuesday questions, and certainly would be something that we would expect on our certification exam as well. So I think there will be a lot of knowledgeable outcomes for that. And it's good because I think, at least in my areas, I see a lot of clinicians get confused on like, what is the cause of the edema? And I think there's just so many good conversations, not about just the management of lower extremity edema, but understanding the etiology of lower extremity edema.
Yeah, and you know, Liz, I want to tell you what's exciting for this. You have a great, well-known physician that looks at this component, and now we're bringing in the therapy component. So in our sessions, we're going to be talking about, not only looking at it, but how do you treat it? Because there's not a lot of lymphedema therapists out there, and the studies will show, as we're going to present, that a lot of times there's a lymphatic component that nobody sees.
Yeah. And Frank, you're certified in lymphedema management as well, too?
Yes. And actually I teach it, and I had a section in a book about it, but it's phenomenal when you start looking at the lymphatic system and how it affects everything. Mark, I'm going to let Mark talk about why we're here a little bit, because I won't steal his thunder.
Well, no, and look, I really want to call out the shoulders of giants we get to stand on, right? So I look at guys, really luminaries in this field, like Steve Dean, who was so influential in helping to educate me on the understanding of lymphedema, and Dr. Stanley Roxon, who's written just some phenomenal papers on what lymphedema is, the under-recognition, the lack of appropriate education to date in medical schools. Dr. Fedora Lori, there's just a host of clinicians that I look up to who have really laid the foundation that have gotten us to where we're at. And then I look at the work in collaboration with certified lymphedema therapists. So what Frank has taught me, what Heather Hetrick has taught me, what other luminaries in the field as certified lymphedema therapists have taught us as clinicians to help us improve treatment and maximize outcomes. So Frank and I are down here today because we get to participate in looking at how can we improve outcomes by understanding adaptability and physiology in crew members that go above what's called the Kármán line, which is 62 miles up or 100 kilometers. When humans go up into low Earth orbit and stay there for more than a day, there's a significant fluid shift of 2 liters from the legs up to the upper torso, the head, and the neck. And for some crew or astronauts, this results in significant changes in vision. It can change diopters, where you can have where your vision changes significantly. And then if you're up for like 6 months, you can start to see even more significant changes, much longer conversation. But understanding these changes then in low Earth orbit for astronauts allows us to understand how to treat our patients better on Earth, because there's such significant swelling we deal with every day, and I think it's under-recognized. And then how do we start to look at what are the technologies that are coming out that help us understand lower extremity edema better? So we would all think of, first of all, physical examination and taking a history. Do your legs feel heavy? Do you swell? And then, of course, ultrasound can help look at venous insufficiency, but also ultrasound can help in terms of evaluating lower extremity edema. And now we know there's other technologies such as point-of-care thermography, which are coming out, which in a more detailed fashion can also serve as a screening opportunity or screening tool to look at chronic venous insufficiency. There's been at least one study published on using point-of-care thermography to look at venous insufficiency. Dr. Sofer published that. And there's also now been 3 publications on looking at point-of-care thermography for evaluation of lymphedema. One was in a filarial model, and then 2 others were in non-filarial, one lower extremity, one upper extremity. So I think there's some new opportunities coming close of non-invasive imaging modalities that are going to give us a quick snapshot of what's going on and really help open our eyes to the diagnosis.
Yeah. It's so interesting because obviously most of our lower extremity wounds in the wound care clinic space is from some form of chronic venous insufficiency. And I feel like, I think it's like 60% of chronic wounds are chronic venous insufficiency in nature. And there hasn't been much, to my knowledge, in ways of like changes in diagnostics and things like that. And so I feel like it's always been the same: manage the exudate, manage the bacterial burden, and compress them, right? And so I think you're talking about these newer technologies, and I think that'll create a whole new shift. So like some great information that clinicians can learn at conference and then take with them directly into their clinics and utilize. So you mentioned the point of care, which I think is a huge shift in all arenas, including acute care space as well. Are there other things that are kind of new and upcoming with chronic venous insufficiency, either diagnosis or management, that you'd like to just give us little hints as to what they'll kind of learn in the session?
Yeah, and actually, I'm going to let Dr. Melin talk about it. But Liz, I've been keeping a secret from you for the last year
What?
plus. I'm not cheating on you, but for the last year plus, I've been using infrared thermography, and actually, we'll discuss some of it in our sessions that we have in Philadelphia. But all this started. The reason why we're here, all this started because Dr. Melin believed on how the new Starling principle or the modified Starling principle affects what we do every day. So do you want to elaborate on that?
So again, I was privileged to do a seminar a couple weeks ago for AVLS, the American Venous Lymphatic Society, and it was all on the endothelial glycocalyx. So we did a little historical journey looking at Starling from 1896, which is the classic function, then going to C.C. Michael, and then Dr. Levick, Dr. Mortimer, Dr. Roxon published a really classic study in 2014. So it is, so I call the glycocalyx EPIC. So just a quick acronym, EPIC, EPIC. So E is endothelial cell function. So when a glycocalyx, it looks like seaweed on top of endothelial cells. Now think about scale. This is 5 microns. It's throughout the body, but at the 5 micron level, where 1 red blood cell is going through, so about the third the size of the hair, which is typically 17, 18 microns. So as the fluid comes across and moves the seaweed, it gets mechanical transduction, or the energy goes into the endothelial cell to produce things like nitric oxide. So the E is endothelial cell function. The P is permeability, so it acts like a Gore-Tex. So this is the big thing, is when fluid goes out, we've all been taught in the classical Starling function that 80 to 90% of that fluid comes back into the vein. What we know is because of the glycocalyx, 100% has to go into the lymphatics. And if that's true, all of a sudden Frank's hands doing manual lymphatic drainage changes everything in terms of getting lymphatic functionality. So lymphatic collectors to work, lymphangion contractility, and that's manual lymphatic drainage, which has been shown in many peer-reviewed studies to be incredibly important for management of lymphedema. So if only 10% went into lymphatics, well, who really cares about lymphatics? Now, the other thing is that it helps with the I is immune function. So we know the lymphatics and the immune function are intimately linked. So the better you get lymphatics to function, the better you get the immune system to function. So we know that when you do really good certified lymphedema therapist management, we see infection rates go down. And then the C is coagulation. So we also know that when the glycocalyx is shed, we see more microthrombi develop. So if you put it all together, EPIC is glycocalyx. The things that cause the glycocalyx to shed are things like hyperglycemia, sepsis, trauma, hypertension, hyperlipidemia. So it's kind of this new area that we can start to impact. There are some medications that are out currently that are available only in Europe, like sulodexide, which helps that. But there's some new emerging ones that are coming out in the United States. And there's some really good endothelial glycocalyx benchtop researchers that are really starting to figure this out. So this is kind of cutting edge stuff. And hopefully we can do another Frank and Lizzie show in a year and talk about what these researchers are producing.
Yeah. And Liz, I can't help to say the whole time I'm sitting here listening to Mark, my mom will be proud. She said, for me, getting close with a lot of smart people, and you can tell. But you know what Mark is talking about is phenomenal. When you look at the technology that's out there, we're able to show that even with manual lymphatic drainage or other techniques, that we can affect the body. So there's more to come. Stay tuned, and I hope you guys can join us at APWCA Wound Week.
Yeah, I mean, obviously with even the small amount of information that we've shared in this episode, I think that obviously there's a lot of knowledge to be gained, and we're not talking about the basics here. We're talking about truly advanced wound care by clinicians for clinicians. And I love that you touched base on the fact that it takes an interdisciplinary team, because certainly that is one of our mission statements as the APWCA, is that we are truly interdisciplinary, as evidenced by, all of us serving on the board and really being there for our membership. So I am very excited to be sitting right next to the two of you soon in February for this conference. So any other words of wisdom before we close out the episode?
Yes, actually, Mark led a phenomenal team of, I call, world leaders. If you look on the Vein magazine September issue, it made the front cover talking about the venous and lymphatic system.
A cover boy.
I know. And in January, in wound management and prevention, the same topic is going to be out there. Dr. Hedrick and I and Mark reviewed the manuscript. It did get accepted, and it's talking about all edema, lymphedema. So very, very insightful article as well.
And again, I'd say incredibly humbling, because great collaborative with multidisciplinary, representing again what we should be putting together in wound clinics. I wish I could have Frank, as a certified lymphedema therapist, work in our wound clinic, because I know it would improve our outcomes.
Yeah, 100%. Personnel is half of it, right? Getting the right people in the right places. I feel that so much in my core right now with my current system as well. So I totally agree.
All right. And I feel the love here in this room.
Oh, that was so clever.
Wound Week is almost February 14th, so it's a common theme.
Well, Philadelphia is the city of brotherly love.
Oh my God.
It's all fitting in.
You'll have to get your picture in front of the love statue. Yeah. All right, guys. Well, thank you so much for joining us. I can't wait to hear your sessions. Both of you, and the two of you together is obviously a phenomenal talk. So we will see you guys. If you want more information on Wound Week, you can visit woundweek.com, or you can visit the apwca.org. Registration, early bird rate expires on December 31st. We are also accepting abstracts until December 31st, so please get those in. Our exhibit hall is filling up, and the registrations are filling, so we're so excited to see everybody. I want to thank Dr. Melin for joining us tonight. And, I'm kind of jealous you guys are in person. I'm up here in Pennsylvania in my office on a Sunday. You guys are in Florida?
In Florida. Fort Lauderdale.
That's exciting.
And I do want to say, everybody, don't forget, Liz is also presenting, and we will have live episodes of the Frank and Lizzie show from Philadelphia.
Yes, we're looking forward to it. Okay, well, be sure to visit the apwca.org. Also, members get a discounted rate, or you can visit woundweek.com as well. Thanks so much.